Can drug use cause schizophrenia? Have you ever wondered if drug use can lead to schizophrenia? This is a common question, and the answer is not as straightforward as you might think. Schizophrenia is a complex mental health condition that includes symptoms like hallucinations, delusions, and disorganized thinking. While drug use does not directly cause schizophrenia, it can increase the risk of developing the disorder, especially in people who are already vulnerable due to genetics or biology. First, let's talk about genetic and biological vulnerability. Some individuals are born with a predisposition to schizophrenia. This means their brain chemistry and neural systems may already be set up in a way that makes them more likely to develop the illness. These genetic factors often involve neurotransmitters like dopamine and serotonin, which play a key role in mood and perception. For those with this vulnerability, environmental factors, including drug use, can trigger the onset of symptoms. Now, what about drug use itself? Certain substances, particularly cannabis, cocaine, amphetamines, and hallucinogens like lysergic acid diethylamide, can trigger psychotic symptoms that resemble those of schizophrenia. For people who are already at risk, using these drugs during adolescence or young adulthood can lead to the development of schizophrenia or a drug-induced psychotic episode. Essentially, drug use can act as a stressor that interacts with a person's underlying vulnerability, raising the chances of developing the disorder. Another point to consider is the co-occurrence of substance use disorders and schizophrenia. Many individuals with schizophrenia also struggle with substance use disorders. This overlap can worsen the symptoms of schizophrenia and make treatment more difficult. People might use drugs to self-medicate their symptoms or cope with cognitive challenges. Additionally, shared brain pathways involved in addiction and psychosis can contribute to this connection. The neurochemical effects of drugs are also significant. Many drugs alter brain chemistry, particularly affecting the dopamine system, which is implicated in schizophrenia. For example, stimulants like cocaine and amphetamines can increase dopamine levels, leading to psychotic symptoms. Chronic drug use can disrupt the balance of neurotransmitters, potentially resulting in lasting changes in brain function that contribute to schizophrenia symptoms. It's important to clarify some misconceptions. Many people confuse schizophrenia with multiple personality disorder or think that drug use alone causes schizophrenia. In reality, schizophrenia is a distinct psychiatric condition influenced by a mix of genetic, neurobiological, and environmental factors. Drug use is just one of many environmental triggers that can worsen or initiate the illness. Understanding the link between drug use and schizophrenia highlights the importance of early intervention and prevention, especially among at-risk youth. Reducing substance abuse in vulnerable populations can help lower the chances of triggering schizophrenia or worsening its symptoms. Furthermore, treatment for individuals with both schizophrenia and substance use disorders should address both conditions at the same time for better outcomes. In summary, while drug use can increase the risk of developing schizophrenia or trigger its symptoms in predisposed individuals, it does not directly cause the disorder on its own. The interaction between genetic vulnerability and environmental factors like drug use plays a key role in shaping the development and course of schizophrenia.